Your doctor probably won't bring this up during a routine checkup, so let me say it plainly. If you've stopped masturbating as you've gotten older, your body may already be experiencing decline, and you might not even realize it. This isn't some joke, myth, or taboo subject. It's grounded in hard medical science, and ignoring it can lead to serious consequences that go beyond your sex life, affecting your heart, brain, sleep, immune defenses, and even your confidence. My name is Dr. Juan James. I'm a urologist and men's health specialist with over 3 decades of experience treating aging men across the country. My career has been devoted to understanding how bodies evolve with age, especially in relation to intimacy, hormones, and long-term vitality. And one of the biggest silent issues I've seen is this: too many older men quietly abandon their sexual health. In doing so, they give up one of the simplest tools for maintaining overall well-being. Here's something most people don't know. Masturbation is not just a leftover behavior from your youth. It's a natural mechanism your body still relies on to balance hormones, stimulate the brain, protect the prostate, and even ward off depression. And if you've stopped, or never engaged at all, the hidden cost may be far greater than you imagine. In the next few minutes, I'll show you exactly what happens inside your body when you give up self-pleasure later in life. What I share may completely shift how you see your health and your independence moving forward. But before we dive in, if you value staying strong, alert, and independent as you age, hit subscribe and tap the bell icon so you don't miss content made just for you. And if this topic speaks to you, type 1 in the comments. If not, type 0. Your feedback helps me shape content that truly supports your health journey. Now let's begin with the first and most overlooked impact of abandoning self-stimulation, its effect on prostate and urinary function. 1. Declining prostate and urinary health. When I began practicing urology more than 30 years ago, I never expected so many men to confide in me about something so private yet so vital: the disappearance of their sexual routine in later life. I recall one patient in particular, early 70s, fit, sharp, and active, but he was waking up 4 or 5 times a night just to urinate, and he couldn't understand why. What he didn't know, and what most men never realize, is that regular ejaculation, even through masturbation, is essential to keeping the prostate in working order. The prostate isn't just a passive gland. It's a dynamic organ. It produces fluid. It contracts. It needs stimulation to stay healthy. When it's neglected, fluid stagnates. That stagnation triggers inflammation, swelling, and pressure that interfere with urination and sexual function alike. Men may feel it as a heavier bladder, weaker stream, or a constant sense of fullness. These are not trivial inconveniences. They are early red flags. And here's the danger. Chronic congestion in the prostate can quietly progress into more serious conditions like benign prostatic hyperplasia, BPH, which affects about half of men over 60. Left untreated, this can lead to bladder infections, urinary retention, and even catheterization. The patient I mentioned earlier eventually required surgery, something that might have been avoided with consistent, simple habits earlier in life. Routine ejaculation helps clear the prostate, flush out old fluid, and prevent harmful buildup. Research even shows that men who ejaculate 21 or more times per month are far less likely to develop prostate cancer than those who don't. And let's be clear, this isn't about reliving your youth or engaging in compulsive behavior. It's not about fantasy, it's about function. It's about using your body's own biology to keep yourself healthy in the most natural way possible. Ignoring masturbation in later life doesn't just mean giving up pleasure. It means inviting discomfort, inflammation, and gradual loss of bladder control. I've seen men become afraid to leave the house because they no longer trust their bladder. I've seen confident men reduced to anxious, sleepless nights, worrying about bathroom trips that could have been prevented. And yes, the emotional toll is real. Losing that sense of control, needing to plan around bathrooms, dreading long drives, waking up every 2 hours, chips away at your independence. This is about more than your prostate. It's about your freedom. But here's the shocking part. What begins in the prostate doesn't stay there. The next consequence affects not just the body, but the mind itself. And once it starts, it can change how you think, feel, and remember, sometimes in ways that are hard to reverse. Let's look at what happens to your brain and mental sharpness when sexual activity disappears from your life. If you're still reading and connecting with these insights, type 1 in the comments to let me know you're here and engaged. Now, let's continue with point number 2. Now, I'm not saying that quitting masturbation automatically leads to Alzheimer's, but here's what I will say. When the brain is starved of stimulation, emotional release, and hormonal balance, it becomes more fragile. It loses rhythm, resilience, and sharpness. For many, that fog thickens until it changes the way they live, the way they interact, the way they think, and even how they see themselves. One man told me he stopped attending his weekly chess games because he couldn't keep his focus. Another, a retired teacher, confessed that he woke up every morning feeling empty and blank. These weren't cases that required medication for memory loss. They were symptoms of a life cut off from physical intimacy, even with oneself. And here's a heartbreaking truth. These issues are preventable. You don't need expensive prescriptions or complicated therapies. Sometimes the solution begins with simply reconnecting with your body, giving it the stimulation it quietly longs for. Because when you awaken the body, you also reawaken the brain. But mental clarity is only part of the story. What comes next, when emotional balance begins to crumble and mood starts to slip without warning, can be even more subtle, more destructive, and much harder to admit. Let's talk about how abandoning self-intimacy can quietly open the door to depression. 3. Increased depression and emotional numbness. I once saw a patient in his early 70s, a widower, generally healthy, who came to me not for a physical complaint but for something he couldn't quite name. He looked at me and said, "I don't feel anything anymore. Not sadness, not joy, just nothing." Then he asked, "Is this normal for someone my age?" That question has stayed with me because I hear versions of it all the time. What many accept as just aging, the dullness, the disconnection, the fading of emotions, often has a deeper, more physical cause. And it's one few people discuss, the absence of sexual stimulation, particularly self-pleasure. Here's the reality. When you stop engaging with your own body in an intimate way, your emotional landscape can begin to shift, quietly but profoundly. Masturbation isn't only a physical act, it's also an emotional release valve. It's your body's natural stress relief system. During orgasm, the brain produces oxytocin and endorphins, powerful chemicals that stabilize mood, fight anxiety, and ease depression. Remove that release, especially at a time in life when stress, loneliness, or grief are already present, and you invite emotional numbness. That numbness can slowly evolve into full depression. I've watched this progression many times. A man loses his partner or decides intimacy is no longer appropriate at his age. Weeks turn into months. He becomes quieter, more withdrawn. He stops enjoying hobbies. He speaks less. His sleep and appetite shift. Slowly, life loses its color. And here's a cruel twist. Most men never connect it to sexual withdrawal. They blame themselves, or they believe it's simply old age. But in truth, what they are missing is the simple, essential act of connecting with their own body, not just for pleasure, but for emotional survival. Depression in older adults is often overlooked because it doesn't always appear as sadness. Sometimes it shows up as fatigue, irritability, detachment, or a complete loss of motivation and desire. And while medication and therapy can be valuable tools, I've seen remarkable improvements simply by encouraging men to reclaim physical self-intimacy. One patient told me he felt alive again after returning to regular self-touch for the first time in years. He said it didn't just lift his mood. It reminded him that he was still human, not just a body waiting to fade away. That one small act gave him back a piece of his identity he thought was lost forever. And this is a lesson I want you to take away. Masturbation in later years isn't about lust, shame, or fantasy. It's about maintaining your emotional health. It's about giving your body permission to feel, to release, to remember what it means to be present. When you lose that connection, you're not only risking sadness, you're risking isolation, emotional decline, and in some cases, the will to keep engaging with life. But emotional health isn't the final consequence. As the nights grow longer and your sleep becomes fragmented, another hidden price emerges, one that threatens your memory, immunity, and long-term health. Let's explore how removing sexual release can rob you of the deep, restorative sleep your body desperately needs. If you're still reading and these insights resonate with you, type 1 in the comments so I know you're here and connected. Now let's continue with point number 4. 4. Poor sleep quality. I remember a patient in his late 60s who came to see me after months of restless nights. He looked drained, pale, and frustrated. "Doc," he said, "I fall asleep fine, but I wake up at 2 a.m. like someone fired a gun in my head. Then I just stare at the ceiling until morning." We ran all the tests. His labs were clean. No sleep apnea. No clear cause. But when I asked about his intimate life, he looked down and muttered, "That part of me is over." But that part of him, the part he thought was gone, was likely the very key his body needed for healing uninterrupted rest. Sleep isn't just about closing your eyes. It's a complex hormonal cycle. And one of nature's most effective triggers for deep sleep is something most people stop using as they age: orgasm. During climax, your body releases oxytocin, prolactin, and endorphins, a perfectly balanced chemical cocktail designed to shift your nervous system from stress into rest. At the same time, cortisol, the hormone of stress and wakefulness, drops sharply. Your breathing slows. Your heart steadies. Your muscles loosen. You enter the ideal state for restorative sleep. Now imagine cutting that natural process out of your life. Not once, but for weeks, months, even years. That's what happens when older adults stop masturbating. The body loses one of its built-in sleep tools. And what fills the gap? Restlessness, frustration, endless tossing and turning. Some turn to sleeping pills. Others simply accept exhaustion as normal aging. But the damage of poor sleep is far more serious than feeling tired. Chronic sleep loss weakens immunity, accelerates memory decline, raises heart risks, and fuels anxiety and depression. In older adults, it contributes to falls, confusion, and loss of independence. I've seen men who once lived active, fulfilling lives slowly withdraw, not because of illness, but because they were simply too exhausted to function. And here's the most troubling part. Many never realized that the very thing they gave up, sexual release, was the same thing their body once depended on for deep, healing rest, not with supplements, but with your body's own built-in release system. Masturbation might look like a small or even trivial act, but for many, it's a difference between 4 restless hours and 7 hours of deep, restorative rest. One patient told me that after reconnecting with this side of himself, "I'm sleeping like I did 30 years ago. I never realized how much my body needed that release. I thought it was just old age." And that's exactly the problem. Too often, people confuse neglecting their biology with simply getting older, and they pay the price in silence. If you're lying awake at night, thoughts racing, muscles tense, hours dragging by, ask yourself, when was the last time you truly let your body relax, fully release? Sometimes the answer isn't a pill, a meditation app, or a gadget. Sometimes it's rediscovering a rhythm your body still remembers, if you allow it. But while lack of sleep can drain your energy and blur your focus, the next consequence is even more physical. It shows up in weakening muscles, shifting posture, and a bladder that no longer cooperates. Let's take a closer look at what really happens to your pelvic floor and circulation when intimacy disappears. 5. Weakening of the pelvic floor and reduced circulation. Years ago, I treated a retired firefighter in his 70s. A proud man, strong most of his life. But he came to me with complaints of mild urine leakage and discomfort in his lower back and hips whenever he stood for long periods. "It feels like the base of my body is giving out," he said. What he was describing wasn't just aging. It was a slow decline of his pelvic floor. And he was far from alone. The pelvic floor is a set of muscles at the base of your core. These muscles support the bladder, bowels, and sexual organs. Most people don't think about them until problems appear. Urine leakage, constipation, erectile difficulties, or pain when walking or sitting. Here's what most don't realize. Regular sexual activity, including masturbation, plays a key role in keeping these muscles strong. During arousal and orgasm, the pelvic floor contracts rhythmically. Those contractions are exercise, not for appearance, but for function. They enhance circulation in the lower body, strengthen structural support, and keep the communication between nerves and muscles alive. When sexual stimulation disappears, these muscles don't just rest, they weaken. Blood flow slows. Tissues lose elasticity. Nerve signaling fades. Over time, symptoms creep in: constant urges to urinate, dribbling after using the bathroom, difficulty holding gas, or even pain during motion. For men, this often means reduced sexual function. For women, dryness and discomfort that discourages intimacy altogether. I've seen independent adults start skipping social events because they didn't trust their bladder. I've seen people embarrassed by leaks when coughing or laughing, never realizing it stemmed from years of neglect in this area. And let me be direct, ignoring your pelvic health isn't just inconvenient. It can lead to falls, incontinence, and a painful loss of dignity. Suddenly you're relying on pads, special underwear, or mapping every bathroom in advance, all because the foundation of your body isn't getting the stimulation it needs. And the longer it's ignored, the harder it becomes to restore. Too many people suffer in silence, ashamed or convinced it's just part of aging. But it doesn't have to be this way. Your body still wants to function, even at 70, 80, or beyond. And one of the simplest, drug-free ways to support it is through safe, regular, intimate stimulation. Reclaiming that connection doesn't just bring pleasure, it restores strength. It boosts blood flow, wakes up nerves, keeps tissue alive, and reminds your lower body it still matters. But this is only the physical side. The next consequence runs deeper, right into your immune system, your cellular defenses, and your body's ability to fight illness. Because what happens in your bloodstream after orgasm may be one of the most important, yet overlooked, health advantages of all. Let's talk about how a lack of intimacy could be weakening your immunity. 6. Reduce immune function. A few winters ago, one of my longtime patients, a man in his late 60s who had always been relatively healthy, came in looking exhausted. He had been sick 3 times in just one season with lingering colds and low-grade infections. I used to bounce back in a day or two, he told me. Now every little bug knocks me down for weeks. When we ruled out diet, sleep, and medications, I asked him gently about his sexual activity. He smiled awkwardly, then admitted, "I haven't been active in years. That part of me is retired." What he didn't realize, and what many don't, is that sexual activity, including masturbation, directly affects the immune system. This isn't metaphor. It's biology. During arousal and orgasm, the body produces a surge of protective chemicals, not just dopamine and oxytocin, but actual immune-strengthening compounds. Immunoglobulin A, IgA, for example, rises significantly. IgA is a crucial antibody that shields the body against viruses, bacteria, and infections, particularly in the respiratory and digestive systems. At the same time, endorphins reduce inflammation and support healing. Now imagine missing out on that boost, not just for days, but for months or years. Your body loses one of its simplest, most natural defenses. At an age when the immune system is already slowing, removing this tool is like taking the batteries out of your smoke detector. You might not notice at first, but when illness strikes, your body won't respond the way it used to. I've seen this firsthand. Patients who stop engaging sexually often get sick more often, recover more slowly, and deal with flare-ups of inflammation they can't explain. While they rarely make the connection, their bodies are sending a clear signal that something essential is missing. And immunity isn't just about colds. It's tied to cancer defense, heart health, wound healing, and long-term disease prevention. Regular sexual release balances hormones, lowers cortisol, and boosts circulation, all vital to a resilient immune system. Remove that, and the dominoes begin to fall. Stress rises, sleep suffers, inflammation builds, and the body weakens. One woman in her 70s, after losing her husband, told me she hadn't touched herself in nearly 5 years. When I explained the connection between sexual activity and immunity, she decided to reconnect, not for desire, but for wellness. Months later, she came back brighter, stronger, with renewed energy. "I can't explain it," she said, "but I feel alive again, like my body is finally working with me, not against me." That's not magic. It's simply what happens when the body gets the signals it craves. Messages that say, "We're still alive. We still want to grow." It's easy to overlook, dismiss, or feel awkward about, but your immune system isn't concerned with shame. It only reacts to action. And sexual stimulation, even alone, is a powerful act, one that communicates vitality and resilience through every cell. While weak immunity can open the door to illness, the deepest cause of neglecting self-intimacy goes beyond health. It reaches into your identity itself. When you stop touching your own body, you may slowly stop recognizing the person you are. Let's uncover how neglect can quietly dissolve self-worth and how you can take it back. 7. The loss of ownership and self-value. I'll never forget a quiet exchange with a man in his late 70s, once a sharp and commanding school principal. When he came for a checkup, his shoulders slumped and his eyes had lost their spark. As we spoke, he sighed, "I don't feel like this body belongs to me anymore. I'm just living inside it." That confession has stayed with me because I've heard it echoed by both men and women in their own words. At some point, they stop feeling at home within themselves. And most often, it begins with silence, abandoning self-intimacy, writing it off as unnecessary, inappropriate, or a stage of life that has passed. But here's the truth. When you stop touching your body, when you stop engaging with it personally, you begin to detach from it slowly, quietly, and sometimes for good. Self-touch is not just about pleasure. It's about presence. Even the simplest act of touch tells your nervous system that you still exist, that you still matter, that your body remains a part of who you are, not just a shell to be left behind. Without that, distance forms. You stop noticing aches, avoid the mirror, and convince yourself that this stage of life doesn't deserve care, and that, more than anything, is the real loss, the erosion of worth. I've seen this disconnection spiral into numbness, shame, withdrawal from closeness, and even neglect of basic care. Exercise stops. Eating well fades. Dressing with purpose disappears. Why bother, they think, when this body no longer feels like mine? One woman told me she hadn't touched herself since menopause. "I just stopped feeling like a woman," she admitted. "And the less I touched myself, the more invisible I became." That word, invisible, hit me hard because that's exactly what happens. Aging adults who let go of physical connection don't just lose pleasure, they lose identity, visibility, vitality. But here's what matters most. It doesn't have to stay this way. Reclaiming your body isn't about trying to be sexual the way you were at 20. It's about honoring the life that still pulses in you. It's about declaring, "I'm still here. I still feel. I still deserve to be seen, even by myself." When you touch your body again, even privately, you reverse that quiet erasure. You remind yourself that aging isn't disappearing, that your worth didn't expire with youth. You come home to yourself, and that may be the most healing act of all. Now, as we bring this journey together, let's connect the dots. Because while each of the 7 consequences stands on its own, together they form a larger, urgent message. Final thoughts. Reclaiming intimacy, reclaiming health. Looking back at years of caring for aging patients, what strikes me most are not just their medical struggles, but their hidden, invisible losses. Losses no test can measure. A man once confident avoids mirrors. A woman who once radiated joy confesses she hasn't felt anything inside her body for decades. Too often, they've been told this is just aging. But I don't believe that. And if you've stayed with me this far, neither do you. The truth is this. The moment you abandon your sexual self, the moment you disconnect from that part of your identity, a chain reaction begins. We've walked through it, how prostate and urinary function decline without release, how the brain fogs when stimulation is absent, how depression creeps in, how sleep dulls, how circulation weakens, and immunity falters. And most painful of all, how letting go of personal intimacy chips away at your worth until you feel like a stranger in your own skin. These are not small side effects. They are not just part of getting older. They are signals, urgent ones, that your body, mind, and spirit are asking for attention. I've sat across from people who felt broken, numb, disconnected, and I've watched their eyes light up again once they reclaimed this part of life. It doesn't depend on youth, or perfect health, or even a partner. It only depends on permission. Your permission to see yourself as worthy of intimacy now more than ever. I know many shy away from this subject. Some feel embarrassed. Others were never taught that sexual health matters beyond a certain age. But hear me clearly, it's not just acceptable, it's essential. Self-stimulation later in life is not indulgence, it's medicine. It restores circulation, sharpens a mind, balances hormones, grounds emotions, strengthens immunity, and protects identity. It's not luxury. It's care. It's a statement. You are still alive in this body, and you are still responsible for its well-being. A patient once told me, I didn't know how much of myself I'd lost until I finally touched that part of me again. That's what this is about, not just living, but feeling alive, not just surviving years, but inhabiting them with dignity, presence, and joy. So if you've forgotten, hidden, or judged this part of yourself, I invite you to reconsider. Your body is still listening, still capable, still worthy. Start small, with curiosity, with kindness, but start. Because choosing to care for this part of yourself isn't only about health, it's about reclaiming your life. If this message resonated, don't keep it inside. Share it, discuss it, and leave your thoughts. Whether you agree, disagree, or wonder, your story matters, and it might help someone else feel seen.